Welcome to Medical Lectures channel. In this video, we are going to discuss trigeminal neuralgia. What is basically trigeminal nerve? The trigeminal nerve is the fifth cranial nerve and the largest of the cranial nerve. Its primary function is to provide sensory innervation to the face, and it is divided into three main branches. The different branches are ophthalmic, maxillary, and mandibular nerves. The ophthalmic nerve is responsible for sensory innervation of the face and skull above the palpebral fissure and the eye and some portions of the nasal cavity. The maxillary nerve is also a sensory branch, and it innervates portion of the nasal cavity, sinuses, maxillary teeth, palate and middle portion of the face and skull above the mouth and below the forehead. Now, the mandibular nerve is unique in that it contains both sensory and motor fibers. It provides sensory innervation of the buccal mucosa, mandibular teeth, and the skin below the mouth. The motor portion of the mandibular nerve innervates all the muscles of mastication. So, ophthalmic nerve is sensory, maxillary nerve is sensory, but the mandibular nerve contains both sensory and motor fibers. Now coming towards our main topic, what is trigeminal neuralgia? Trigeminal neuralgia is a chronic pain disorder that mainly affects the trigeminal nerve. It is basically characterized by sudden, severe, and intense facial pain that can be triggered by even a mild stimuli. What are the causes of trigeminal neuralgia? Trigeminal neuralgia is often caused by compression or irritation of the trigeminal nerve. The compression or irritation of the trigeminal nerve might be caused by blood vessels that comes into contact with the nerve as it exits the brain stem. Other potential causes of trigeminal neuralgia include multiple sclerosis, certain tumors that affect the nerve. In some cases, the cause is idiopathic. Idiopathic means unknown, meaning it's not clearly understood why the condition has developed. What are the symptoms of trigeminal neuralgia? Sudden, intense pain, typically on one side of the face. Pain attack can last for a few seconds to about 2 minutes. Numbness or tingling sensation on that side of the face. A burning, throbbing, shock-like or aching sensation of the pain. Attack of the pain that occur regularly for days to weeks, or it might take longer. Sometimes it might take several times. It might occur several times a day. Triggering factors of trigeminal neuralgia means what are the factors that can trigger trigeminal neuralgia. So following are the factors that can cause or trigger trigeminal neuralgia. These factors are touching the skin lightly, washing your face, shaving your face, brushing teeth, blowing the nose, drinking hot or cold beverages, encountering even a light breeze, applying makeup, smiling and talking. All of these factors might trigger trigeminal neuralgia. What is going to be the pain history of a patient who is suffering from trigeminal neuralgia? The patient is usually going to complain about unilateral facial pain. Onset is going to be sudden. Pain onset is going to be sudden. Nature of pain is going to be sharp, stabbing, more like electric shock. Pain would radiate from the angle of the mouth to the lips, chin, gum, cheek, and then ear. Now, how to diagnose trigeminal neuralgia? Diagnosing trigeminal neuralgia involves a thorough medical history and a physical examination to rule out other potential causes of facial pain. MRI may be done to identify any structural abnormality or compression of the trigeminal nerve. The diagnosis is primarily based on the characteristic pattern of sudden, severe pain attacks and the trigger points associated with those attacks. Now, how to treat trigeminal neuralgia? There are two options. One is medical management and second is surgical management. Medical management include anticonvulsants, carbamazepine, Tegral, Tegral is very effective for trigeminal neuralgia. Another one is antispasmodic, which includes baclofen. Surgical treatment. If medication fails to relieve pain or produces intolerable side effects such as cognitive disturbances, memory loss, excesses, fatigue, bone marrow suppression, or allergy, your doctor may recommend surgical treatment. Several neurosurgical procedures are available to treat trigeminal neuralgia. Now, the choice of the procedure depends upon the nature of the pain, your preferences, physical health of the patient, blood pressure, and previous surgery. Presence of multiple sclerosis might affect the choice of the treatment and the distribution of trigeminal nerve involvement. Now, surgical treatment involve these three procedures. One is microvascular decompression, one is gamma knife radiosurgery, and third is rhizotomy. Microvascular decompression is a surgical procedure. It involves relieving the pressure on the trigeminal nerve by repositioning or cushioning the blood vessel that was compressing the trigeminal nerve. Gamma knife radiosurgery. It is a non-invasive procedure that uses focused radiation to damage the trigeminal nerve and interrupt the pain signals. Rhizotomy. In this procedure, the nerve fiber causing pain are selectively damaged using heat, chemical, or other means to disrupt their ability to transmit pain signals.